Welcome to Avista Hospital. We're thrilled to have you as our patient. By now you've chosen to have your surgery with us, and this class is aimed at getting you prepared to have the best possible outcome. When you come to Avista, you'll come to expect specialty certified care. And what that means is that a national certifying board has come in and evaluated our hospital and has designated us as a center of excellence for both joint replacement and spine surgery care. You'll also have comfortable private rooms and 24/7 visiting hours for your friends and family. Our goal is to get you back to doing what you love. The theory is that there was some level of activity that you used to enjoy doing, that now, because of pain or disability in your joint or your spine, you have not been able to perform this activity. Identifying what that activity is key in being able to rehabilitate and get back to doing what you love. Whatever it is for you, try and think about what that particular activity is that you're trying to get back to doing. We might even ask you what that is while you're here, and it can be a good conversation starter to help us get to know you better. By now you should have received either a joint surgery guidebook if you're having joint replacement surgery, or a spine surgery guidebook if you're having spine surgery. Turn with me to the page entitled Surgery Preparation Checklist. This is page 2 in both the spine surgery guidebook as well as page 2 in the joint replacement surgery guidebook. If you don't have a guidebook, just follow along, but when you get to the hospital, make sure to get one of these guidebooks as it'll be a great resource for you. Keep in mind, during this presentation, we're not going to go through every single thing in these booklets. There are some things that are specific to certain patients. We're going to be going over the highlights, but please read the booklet in its entirety in order to maximize your outcome. Very important to avoid doing any other procedures between now and the time you have surgery. This would include any dental procedures or a colonoscopy or maybe a skin biopsy, anything that you would have done in your doctor's office. Try to avoid that between now and surgery. If you absolutely have to have that done, then make sure you contact your surgeon to indicate any updates and changes to your medical history. Next on the list, I'd like to make sure everybody thinks about having assistance when they get home. Now, for the first 72 hours, we recommend that somebody is there all the time to help you. Now, this isn't someone that has to physically pick you up or do any of your exercises with you, but this is someone that's available to make a phone call on your behalf, to make sure you're getting meals, to help you get safely to and from the bathroom or out of bed if necessary. Maybe they could help tie your shoes if that's necessary. Next on the list is infection prevention. So, in our pre-surgery testing appointment that you will have with one of our pre-surgery testing nurses, they'll give you a bag of chlorhexidine gluconate cloths. You don't have to remember that name, but they're a cloth with an antimicrobial and antibacterial solution on them, with which you will take and prepare your surgical site the night before. Now, when you get here to our hospital, we will do a secondary cleanse as well as a third one right in the operating room before you have your surgery. But you will have the responsibility of taking these wipes and preparing your surgical site the night before. So please follow the instructions of your pre-surgery testing nurse. Next on the list is to stay well hydrated in preparation for your surgery. This means drinking plenty of fluids in the days and weeks leading up to your surgical procedure. However, it's important to stop eating and drinking anything the morning of your surgery, so consult your pre-surgery testing nurse in order to determine just exactly what time you need to stop eating and drinking. Now, beyond that, you should stop any blood thinners, generally about 5 days before surgery, but there are certain blood thinners that get stopped sooner. So, again, consult the pre-surgery testing nurse in order to determine exactly when to start and stop various medications, including blood thinners. You should also consider purchasing some stool softeners because when patients are on narcotics for pain management, that can cause constipation. So be prepared to be on some sort of stool softener when you get home. The next on the list is obtaining the proper equipment for when you go home. If you will require a walker, which is common, it's wise to try and get one ahead of time. Crutches are also useful. If you feel like that will help you, go ahead and get your crutches ahead of time. We recommend a cane for certain patients, especially our joint replacement patients, so go ahead and try and acquire that equipment before you get here. Some spine surgeries require a brace, so if your surgeon requires that you wear a brace, whether it's around your lower back or your neck, please make sure you have plans to get your brace ahead of time. Next on the list is beginning your exercises. Now, Exercises are also found in this booklet, and our physical therapist will be going over that with you in detail. However, the recommendation is to make sure you start your exercises ahead of time so that you're familiar with them and you're not learning something new after your surgery. Next on the list is discharge planning. The idea with discharge planning is understanding that from the hospital you will need to be going either home or to some kind of rehab facility, so be thinking about what's the most appropriate for you ahead of time. Now turn over to page 3 in your guidebook. Again, this is the same page in both the joint and the spine guidebook. It's entitled Preparing Your Home for Your Return. The recommendations we have are more or less common sense. It's best to think through your home environment and look around and identify any obstacles that may be problematic when you return home. If you're going to be on a walker, make sure there's space for your walker to fit through the areas in your home. If you have loose cords, that could be a tripping hazard. Throw rugs as well could also be a hazard that you never dealt with before, but now that you just had surgery, might be something you could trip over. So consider the obstacles and the potential hazards and move things away, adjust furniture placement, remove cords, secure them if necessary. If there's been a loose railing in your house going up the stairs, now would be the time to tighten that stuff up. If there's anything that's high that's difficult to reach or low that's also difficult to reach that you use on a very common daily basis, maybe bring those things out onto the surface level. If you're going to be cooking, maybe the butter, salt and pepper, seasonings, things that you don't want to have to reach for, go ahead and put those out on a nice easy surface level. Toothbrush, toothpaste, deodorant, things in your bathroom that you could also use on a daily basis. Might be nice to have out at a surface level so you're not bending down to pick them up or reaching up high to grab them, because you won't be able to do that very well after your surgery. The next page in your joint or spine guidebook looks like this, entitled The Day of Surgery Checklist. Please turn there with me as we go over what to bring and what not to bring. One of the most important things is to make sure that you arrive on time. The pre-surgery testing nurse will tell you just exactly what time to be here. I recommend you bring this guidebook with you to your surgery. This has a lot of great information and you may be referring to it, particularly your physical therapy exercises, while you're here. You should also bring some loose and comfortable clothing. You don't have to be in a hospital gown the whole time you're here. It makes you feel a little bit more like a patient, and we like you to feel like a person. So you can bring your own clothing, but make sure it's something that's comfortable and easy to get on and off. A lot of belts and buckles and ties are difficult, but if you have slip-on things with elastic, it's handy. Make sure that you have closed-toed footwear, but a slip-on version can make it easier to get on and off. Also, please bring with you any health aids that you use regularly. For example, if you wear glasses or hearing aids or dentures, bring those with you. If you wear CPAP at night to help you breathe, make sure and bring that with you as well. And any other items that will help you on a daily basis that you use at home. Bring toiletries as well if you'd like your own. Now, we do offer toothpaste and toothbrush and deodorant, but you can also be more comfortable when you bring your own stuff. Also, bring with you your living will or durable medical power of attorney if you have that filled out. And if not, we can give you those forms here to fill out at the time of your surgery. Also, there's some things that are important not to bring. We don't recommend you bring anything valuable while you're here. You don't need to bring jewelry, and in fact, jewelry has to be off of you during surgery anyway, so it's important to leave those things at home. You may bring them, and you may put them on after surgery, but it's just a risk that you might not want to take. We also don't recommend you bring any significant amount of money, as there's nothing really to purchase here. There is a gift shop that if you'd like to access, you may, but everything else should be covered by your insurance policy, and so there's really nothing much to purchase. Now, friends or family that would like to stay with you may purchase food from our room service or cafeteria for cash or credit or check. Other than that, there's really nothing valuable that you need to bring while you're here. One major thing we need to discuss is pain management. One of the things that happens after surgery is that you will have pain. I must say that there will not be a situation where your pain is zero after surgery. Expect to have some pain after surgery, but our goal is to make it as comfortable as possible in a safe manner. You will be receiving this pain rating scale card, similar to what we have up here, and this is a way of making an otherwise subjective measure into an objective measure. The idea here is that there is a scale of pain from 0 to 10. Now, not everybody's scale is the same. Some people's 2 is another person's 4. And some people have a wider scale, or potentially it's shifted compared to someone else. But the idea would be that everybody has a 0, and 0 is no pain at all. And everybody has a 10, which is the worst possible pain imaginable. And so somewhere in between, everybody will experience their pain. So try and imagine what your pain is that is a tolerable amount of pain that you could function and do daily activities. That will be your pain goal. At this point, we're going to move on to what to expect on your surgery day. When you get to the hospital, you will register at our admission desk. And when you get here, tell them you're here for your surgery, and they'll bring you over to a place called pre-op. And in pre-op, you'll meet your pre-op team. There will be a nurse that checks you in and asks you a series of questions. They will establish an IV and get you some fluids and some basic medications. You'll also be visited by your anesthesiologist, and they will discuss with you the type of anesthesia you'll undergo. Most commonly, for a joint replacement, a spinal anesthesia is recommended. Alternatively, a general anesthesia is also a very safe alternative. For most spine surgeries, general anesthesia is usually recommended. But you can have a conversation weighing the risks, benefits, and alternatives to any kind of anesthesia mechanism that your anesthesiologist recommends. So be prepared to have those conversations when you get here. Your surgeon will also visit you in pre-op as well, and they'll be confirming with you what surgery they're going to perform and ask you if there's any other questions you have. So be prepared to ask them those questions at that time. After the basic check-in, you will also undergo the secondary preparation of your surgical site, as I mentioned before. After the pre-op visit, you will go into the actual surgery. There, the actual anesthesia will be performed, and then the surgery is performed as well. And finally, your friends or family that came with you will be invited into a private consultation room where, after your surgery, the surgeon will come to discuss with them how things went. In the recovery area, which is also known as PACU, PACU is an acronym that stands for the Post-Anesthesia Care Unit. There, you will notice a few things. You might have what's called SCDs. This stands for sequential compression dressings. These are pneumatic pumps that go around your lower legs to help recirculate blood flow and prevent against blood clots. If your surgeon has decided, you may have a drain that's attached to your surgical site. This is to collect any residual blood that is produced during the surgery. Another version of it looks like this. And you may or may not have a urinary catheter helping to empty your bladder. So be prepared to see some of those things. One of the things you'll also see is an incentive spirometry machine. Now this is to help you encourage deep breathing. After spending an hour to 2 hours in the recovery area, and you've demonstrated that you're stable with respect to oxygen demand, stable vital signs, and your pain is well controlled, as well as being alert and awake and functional with respect to your spinal anesthesia, meaning that it's worn off to a point where you are able to feel your lower extremities, you'll be brought down to the inpatient unit. At that point, you'll meet the nurse that will take care of you on an inpatient basis. And this is some of the things that you will be assessed for. Make sure that your pain, again, is under control and that you do not have excessive nausea and that you are able to start mobilizing. Don't be surprised if when you get to the floor, you're encouraged to get out of bed with supervision, even within the first 4 hours after surgery. So the next day is going to be centered around optimization of your care. Clearly, pain management is one of the primary goals while you're here, and we will utilize any modality that's necessary. Often it includes narcotics, as well as muscle relaxers, potentially anti-inflammatories, ice therapy, or any other modalities necessary. Often patients have other medical conditions that need to continue to be managed, but you'll also be consulted with a respiratory care team, a nutritional care team, and any other consults that are necessary while you're here. You will continue undergoing physical and occupational therapy while you're here, and your nursing care will continue as well. The day is going to be spent getting you prepared to go home. Now, depending on your surgery, some people go home the very next day, but some people also need to stay longer depending on what surgery you've had and how your condition progresses. Some of the main criteria that are required before you can go home are that, first of all, your pain is managed in a safe manner, that you're ambulatory and able to function on your own independently, and that your medical conditions are safe for a home return. So, Once those are managed and met, then you may be discharged home. Some people don't meet all those requirements and require a discharge to a facility, such as a skilled nursing or a rehab type facility. The next day after your surgery, we're going to be starting to talk about what's an appropriate discharge plan. So our discharge planning team will also visit you and consult with you and discuss what the options are based on what your insurance will cover, as well as what your needs are. So be prepared to discuss discharge planning as well. Some of the things we'll be discussing upon discharge are, number one, wound care. So that means if a dressing change is required, you'll be instructed how to do that. Next is follow-up. So you'll be instructed when to see your physician or any other consults after you leave the hospital and when to follow up with them. We'll give you instructions on how to fill your prescriptions, should any be given at the time of discharge, as well as what the activity levels are that you're going to be required to abide by. So there may be some restrictions on your activity level or your weight-bearing status, and so those instructions will be given to you at the time of discharge as well. So with that, I'd like to turn it over to our physical therapist to go over all the exercises you'll be responsible for. Thanks, we look forward to seeing you.